My name's Mark Perry. I'm 37 years of age. What I do is that I take care of corporate events for an international event management company and conference company.
Want some of this?
When I first sort of noticed the hair loss was that it was on two occasions. I was on holidays and just away with the family and never noticed that, you know, my head was getting burnt. And in 37 years, been away, whatever, 2 holidays a year, and just never had the chance, never noticed that I had to put sun cream on my head. So then that sort of noticed when I was coming out of the swimming pool, I was going, oh my God, so there's this sort of, I suppose, a patch that sort of was never there before. So I suppose the penny dropped. That I think something was missing.
There, look.
Boat. I would never say I was vain. I would never say I was sort of conscious of my hair. And I think, you know, coming from my uncles and in-laws and so on, that they don't have much hair. But there was a lot of slagging and there was a lot of sort of wind-ups about, you know, your hair is going to go. But I never totally noticed of it. But then when, I suppose, the holiday happened and this patch just started appearing, I was like, okay, well, there is something that I suppose I need to sort of have a look at.
Having made the decision to investigate his options, Mark chose HRBR, and following extensive consultation, it was agreed that in his case, a transplant would be appropriate. Now, with the date for the procedure set, Mark visits HRBR for his pre-op checkup. It's an opportunity for the team to inform and reassure him about the upcoming operation, and it also allows them to perform a final health check. On arrival, Mark is brought to one of the patient rooms and given a healthcare questionnaire to fill in.
Okay, brilliant. So we'll try not to keep you too long. It generally takes between 40 to 45 minutes, depending on how smoothly we run through everything, okay? But it's broken up into 3 separate parts, okay? So the first part's the education, so that's where I come into play. And I go through the healthcare questionnaire with you as well, all right?
Brilliant.
What I'm going to discuss is what to do before the procedure, what to do on the day of the procedure, and what we'd like you to do afterwards, okay?
Okay, brilliant.
Vicki takes Mark through the questionnaire step by step. He is about to undergo surgery, and it's therefore vital that the team have a full picture of Mark's current state of health. She talks through exactly what Mark should expect from the procedure. She then takes him through the post-operative instructions, including a list of important do's and don'ts.
So traditionally you stand under the shower, you put the shampoo on the scalp, give it a good rub it up, don't think anything of it, okay?
But to be very gentle.
Yes. Instead of rubbing the product in, we just want you to pat very gently. It takes 2 weeks for the graft to be completely embedded, all right? So the roots need that time, they need the 2 weeks.
Okay.
So you just need to mind them, but we don't want you to be a hermit, sit in the house doing nothing, okay? Yeah. Try get some fresh air and get out and you can go back to work.
Brilliant.
Is that all right?
Perfect.
Excellent. Do you mind if I take your blood pressure?
Not at all, not at all.
The second part of the visit involves a medical check. The patient's well-being is, of course, our highest priority. So Mark has his blood pressure checked and is then taken to a treatment room where he's weighed and given an ECG to ensure that all's well.
Our industry is considered young, funky. You know, it's very, very creative, and what you're sort of really what you're selling is creativity. And I suppose I'm getting older, the clients are getting younger, depending who you're dealing with. And yeah, it just started affecting because, you know, I suppose you are the face, you are representing the company, and I suppose everything that is about you is something, your looks, your personality, how you interact, you know, you are the client facing, and yeah, it did again sort of solidified to go, well, you know what, should I be looking at this, should I not be looking at it? And the decision was, yeah, I should be looking at it.
Yeah, I'd say an average of 90.
In preparation for the procedure, the team then make a detailed examination of Mark's hair in order to determine the density and hair count within the donor area. This is vital information that's needed in order to accurately plan the distribution of the transplanted hair.
We could get 3,000 to 3,500 grafts in one go, but Vicki probably explained the massage to inside,
she did, yeah.
So if you do more of that running up to your surgery, we could get even more than that. Yeah.
Okay.
So the more massage you do, the better. Okay, so I'll give you a mirror. If you hold on to that there. So if you just
It's important that the team understand exactly what Mark wants, while being clear to him exactly what's realistically possible.
If I could bring it forward just a tiny bit, if anything, like I don't want to bring myself to where I was age 21 or 22, but just something that I suppose when I'm in any photographs of someone, all I'm seeing is that this big forehead.
Okay.
and try and disguise
So
that where possible.
basically reduce the size of your forehead.
Yeah, if possible.
The transplant will transform Mark's appearance. It will be a new and permanent hairline, and it's the attention to detail at this early stage that will help ensure that once it reaches full maturity, the transplanted grafts look completely natural. It's important that Mark's new hairline is appropriate for his age. All men have some kind of natural recession of their hairline as they grow older. So, when making the initial design, the team are careful to take this into account.
Could we go maybe on the inside?
No, I think it's low enough. Maybe take this side up.
We'll show you this anyway and see what you think.
No, have a look there.
Now it is just black marker and nothing's set in stone, but this is just the general position of like how far you would transplant up to here. Okay. So we would put like little single hairs in peaks out in front of that to give you that uneven feathered kind of hairline, so it wouldn't be any like black lines in it.
With the amount that you're saying, like 3,500, is that enough to cover all that area?
Yeah, it is on this design.
Just concentrate in the front, so get as much density into here as we can, and then whatever else we get, we'll just go further back.
Okay, so if you get the 4,000, you're just going to bring it. Okay,
yeah. What do you think of the general position
of
the hairline?
It's an improvement.
If you turn around and just face the back there.
The initial design is photographed. The photographs will serve as a starting point for the consultant and the team on the day of surgery. But for now, they will also help Mark understand what will be going where.
You can even see the line as well. That's going to be the transplant will go to here.
Okay.
So you can see it still leaves it, high. It's not too low.
Yeah.
If we look from the side angle, you can see it will run perfectly around, and so it'll leave you with that nice natural shaped recession, which is what you need to keep it natural looking in years to come. So we'd be transplanting all through here, all through that existing hair, and your 3,500 will probably get you back to somewhere about here.
Okay.
Because we want to make sure that we get density into it. So if we try and spread the grafts over the whole surface at the top of your head, you won't get as good density. And the crown's actually not too bad. It's actually fine. There's
Quite strong, actually.
It's very strong. Any questions at all?
No, not at all. That's brilliant.
You're happy with that general design?
Honestly, yeah, perfectly happy.
Yeah.
Tomorrow, that's when it's sort of going to really hit me. But at this moment in time, no, I'm excited. There's been a lot of talk about this. It's been in the planning for 3, 4, 5 months, and it's now crunch time.